Now to Diya Gupta in New Delhi. Diya, how representative are these figures of what is actually happening across India?
So, I mean, in short, the figures aren't entirely reliable. And as you know, India right now is the third worst hit country after the United States and Brazil. We've crossed the 1.5 million mark. And more worryingly, some areas are seeing a much sharper rise in cases than others. So, densely populated cities and states like Delhi, Bihar, and Maharashtra, where the study was conducted in the commercial capital of India, Mumbai. Mumbai has over 20 million people. 9 million of those people live in slums, and these slums are obviously extremely congested. People live basically cheek by jowl. So, a city commission study here claimed that about 57% of the slum dwelling population had been infected by the coronavirus and had antibodies in their system. Uh, but as you said, only 7,000, approximately 7,000 samples were collected. So compared to the 9 million population of the slums and 7,000, the numbers really aren't entirely reliable. Naturally, people have fresh doubts about the real number of cases in the country in general. And so we still really can't say with confidence that this is a reliable figure. Still, India's figures overall are concerning, with some states like Bihar kind of with a population of 125 million people going back into lockdown. And health experts are concerned that the crisis could continue and get worse as cases mount, and a second wave could be looming. So, our only option is to wait and hope.
Very quickly, Diya, how does the Indian public view the government's handling of the pandemic?
So overall, it's a largely positive view for many Indians, and to an extent, the Modi-led Indian government did enforce the lockdown in a fairly strict and timely manner. So while the number of cases seems very high at 1.5 million, the recovery rate is also quite high, and coupled with a low death rate. But and this is a big but. The testing rates in India are abysmal, and there's a clear lack of transparency when it comes to how deaths and cases are catalogued in the system. I mean, footage of crematoriums and burial grounds overflowing with bodies were also recently going viral, and the images on ground don't make sense if the death rate is really as low as is claimed. And then, of course, an enormous section of the population was much worse hit than others. Daily wage earners, migrant workers, hundreds and thousands of people were left homeless, unemployed, and hungry. So in India, I mean, the problem is that we can never really be confident of what exactly is going on, and that a certain large section of the population has been left completely defenseless.